Alcohol-related deaths rose by 20% in 2020 in Liverpool. From reading the Public Health Annual Report commissioned by Liverpool City Council, more people were dying of alcohol addiction during COVID because they didn't seek help, they didn't visit their GPs, and services were reduced during the lockdown. India and South Africa instituted a full alcohol ban during that time, whereas some alcohol companies in the UK went as far as branding themselves essential goods, a term usually saved for medical items and food. Alcohol Concern found that 51% of people were drinking more since the start of the lockdown, and some days it could be up to 5 units or more. This equates to at least 3 extra beers or 5 shots.
I did more dry months during the pandemic, but when I was drinking, I probably drank more. Okay. Yeah.
What was that like?
It was all right. It was a bit miserable, but it was what it was. I mean, everyone was in it together, so it was okay. But I think when you were drinking more, it was probably more miserable. Yeah.
100%. Yeah.
How so?
Because obviously all the pubs are closed, so instead of going to the pub for have a cheeky pint, I was having 4 or 5 cans a night at home.
Around 8 million people were drinking at an increased or higher rate during July 2021 to October 21. This is around 18.1% of adults in the UK, according to a YouGov survey. Since the pub were closed, so was the regulation on drinking. There's no one to stop you in your own kitchen. There's less money pressures when you're paying supermarket prices, and there's very little limit. The British Liver Trust helpline saw an increase in calls of over 500%, an indicator of how many people needed help. Over 150,000 people visited their coronavirus page since it was published, looking for help and guidance. I've been meeting with health and addiction support experts throughout Liverpool to understand the consequences in the rise of alcohol consumption during the pandemic.
In terms of physical health, escalating patterns of alcohol and again increasing quantity and frequency associated with a large number of cancers ranging from mouth cancer to colon cancer and things like that, stomach cancer, liver cancer. And we know, for example, with regards to cancers, then the age where that's being onset is actually reducing as more and more people are experiencing problems with alcohol use.
I think a lot of it with alcohol, I always say this, if they discovered alcohol tomorrow, it'd be a Class A drug. The expense it costs to the NHS service, the damage it does to the person themselves individually. Illegal drugs do not cause as much damage or create as much money and a need for money. It's highly unlikely they're going to make it illegal, but that would solve an awful lot of things. I think for me, it's really important for the medical profession to understand and take on board what needs to come in the way of help for somebody. It's very easy to prescribe someone with medication for a detox. It doesn't take away the reason why they drank in the first place.
Certainly with after the COVID, people were a bit scared to come out and come to groups. Someone actually said to me, John, everyone's gonna know what we feel like. You know, that fear of going out, bumping into people, talking to people, catching something.
We teach people about the 12 steps, which the anonymous fellowships of organisations such as Narcotics Anonymous and Alcoholics Anonymous, Sex and Love Addicts Anonymous, Gamblers Anonymous. There's many 12-step fellowships out there which teach people how to change the way that they live their lives. They teach us how to deal with the wreckage of our past, and what we do is we put people on that path. We start them, we show them what they need to do so that when they leave our services, they've got ongoing support.
So the services, the counselling and the Brink of Change were on Zoom. But, you know, because with addiction, you cannot lock someone with addiction up in their own home, in their own heads. That's not a good, that's not a good combination for any healthcare, is it? So we made sure, and the therapeutic staff would phone everybody. Are you okay? What are you up to? You know, we'll send you stuff. You can pick stuff up at the door. So we just had to, like you do, adapt.
In March 2020, the then Prime Minister Boris Johnson told the public to stay at home.
From this evening, I must give the British people a very simple instruction. You must stay at home. Because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. one form of exercise a day, for example, a run, walk or cycle, alone or with members of your household, any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home.
For some, that meant days and nights out of routine, struggling to juggle the new work-from-home lifestyle, looking after friends and family, and homeschooling. 12% of men in Liverpool apparently started drinking more, and 11% of women. Yet amongst 15 to 49-year-olds globally, alcohol is the leading risk factor in ill health, disability and death. Approximately 70 people die from alcohol-related causes in the UK every day. Let's take a look at what alcohol addiction really is. I spoke to Professor Harry Sumnall from Public Health Institute John Moores to really get to grips with what the disease is.
Yeah, so a complex relationship between alcohol use and mental health and psychological functioning. So we do know, for example, that people who begin to experience psychological distress and reductions in psychological well-being might actually drink alcohol to cope, particularly if they're anxious or depressed. And people might use alcohol to cope. That can lead to an escalation of not only alcohol problems but also mental ill health. Leaving that to one side, even in people who don't have those pre-existing deficits in well-being, continued alcohol use can actually lead to mental problems in itself, particularly depression and anxiety as well.
Liverpool is known for its fantastic history, abundance of culture and prominent music scene. Firstly, John Sloan, who runs the Our Space Group with Leslie. The Our Space Group is a welcoming space for people who want to seek treatment but are not sure how. John calls it the people you don't know exist.
We started it 9 years ago because we both worked in healthcare, and we recognised that people on detox from alcohol didn't necessarily want to go to the recovery assets that were out there, mainly because they were very nervous and anxious, and they had a lot of views and a lot of misconceptions about what recovery was actually about. You know, people do come and they find their own recovery assets. Some people go to AA, some people go to NA, some people go to a place called the Brink. Some people go on to treatment centres because they realise that actually the drink wasn't only problem, because the further you get on in recovery, you realise that actually drink is the medication that you're using for yourself, and actually there's deeper issues underlying from childhood, not necessarily trauma or abuse, but just an emotional displacement where people haven't felt at ease in their life, so they use alcohol. And of course, if you use the same thing over and over again, it becomes a neural pathway. That's the only coping mechanism people have. And it was the same for me. You know, I was brought up in a good family. I worked from an early age. My granddad was the foreman in a Ford garage. He got me an apprenticeship. I had a good career car spraying in all the top garages in Liverpool and surrounding area. However, because alcohol was my only coping mechanism for not just when bad things happened, when good things happened, when it was payday, when it was my birthday, when it was Christmas, you know, because that was the only coping mechanism I used. In the end, it was my downfall. And I lost a lot of things. I lost my long-term relationship, I lost my career, I lost where I lived. And I was coming for help, but I was coming to help to doctors, to psychiatrists, to psychologists. And actually what I needed was just other people. I manage the group, I'm not the boss. But I will help people, and I will push them, and I will tell them the truth as well, because sometimes that's what you need. Like I say, I was going to doctors for years because of my story, and you know, it's quite sad what happened when I was a teenager. But that was my excuse to drink, and it was only when someone said, it was actually in a treatment centre when I had my assessment. The guy said, "John," he said, "What do you want from us?" And I said, "I just need a 2-week lie down and I'll go back to work because I'm a car sprayer." And he leaned across the table, he said, "John, you're not a car sprayer." He did swear. He said, "You're an alcoholic and you need to do something about it." I'd had a couple of drinks at that point, and I did get I got a bit of a cob on, but I know today he was telling me the truth, and he was telling me the truth to help me. So that's how I kind of, you know, try and help people, by being honest with them, by telling them the truth, by telling them what I see, because they might be under a misconception, or they might be doing the best, but quite often it's coming from a place of fear, anxiety, poor mental health, low self-esteem, low self-worth, under the influence of alcohol. Well, when you're under that condition, you're not thinking straight, and you need someone to be there to be straight with you. Not forceful or tell you what to do, but just say, look, can you see what's going on there, kid?
Schooling, meeting and even Zumba turned to web calls. Zoom's revenue grew by 319% in 2020. Face-to-screen calls became the norm, and this was no different to therapy. So how were addiction services able to offer effective treatment methods? I met with a couple of services to find out more.
My name's Donna Williamson. I'm very proud to say I work for Forward Trust. I've been here for 3.5 years now. Yeah, so based in the Brink we have our dry cafe, which is our Brink Cafe. So that is for anybody who's wanting to dip their toe in to become an abstinent, or as we call them, lay people, family members, people, the general public who will come in and use the cafe. It's also a very safe space. Well, when COVID hit, obviously all services within addiction had to very quickly adapt, and the great side is we're very good at adapting, because you know no 2 days are the same. Obviously with all the restrictions, most of the things went on to Zoom. So the classes, obviously, you know, people couldn't come to the classes, but the therapeutic staff right throughout COVID were based in this building, like they were in Shaw. So it was all on Zoom. We did Qigong. I delivered Qigong and therapeutic services. Well, it was hard at times, because you know how valuable connection is to recovery. So it, you know, I was working from home at the time. I'd be phoning everyone, and you know, your 20-minute phone call would quite easily become an hour phone call, and then you're phoning, you know, 15 people throughout the week, and you're dropping stuff off to them and knocking on their door and running away and leaving a pack, and you know.
My name's Leslie. I am the lead case manager here. I've worked here for about 13 years. I am a qualified social worker. That's how I ended up here. I've done my 3rd year university placement, and I've been here ever since. I run the admissions department, which basically oversees everybody who wants to come into treatment and gets them into the position to come into treatment, be it helping them get clean and sober, secure accommodation, sorting benefits out. We just do the whole 9 yards to get somebody into treatment, really. Yeah. When lockdown first happened, I think the demand went down, because most people believed us that we were closed, because a lot of services did close, and a lot of services went either over the phone or online. We stayed open for quite a while until the absolute lockdown, and then we transferred our programme to Zoom, so we were still able to give the full treatment package on Zoom, and it was really successful, so we were really glad about that. And then once we came out of lockdown, we seen the increase go up quite a bit. But it was just really interesting of how many people phoned or called in to say, oh, are you open now? And we'd always been open, which not many services were. So I think that's why the decline. Also, I think a lot of people genuinely were fearful of COVID and just stayed in their own homes, you know, and really just abided by that, but didn't seek help then as well. They thought everything was closed.
Services closed, bottles were bought and lives were lost. So what does need to be done to make sure that addiction services aren't left in the dark? In February 2019, Professor Dame Carol Black was appointed as lead by the government to review harm that drugs cause and understand the prevention, treatment and recovery. Dame Carol Black explains that if the government invests more in treatment, this money should be ring-fenced, and local authorities must be required to work with wider health, employment support, housing and criminal justice partners to develop joint commissioning plans and to be held to account for these plans and their outcomes. So what does need to be done to make sure addiction services aren't left in the dark?
My name's Fenella. I currently run a few organisations in Liverpool. We can recover, we do recover, and substance rehabilitation, and we provide help for people with drug and alcohol problems in the city, and have done for the last 3.5 years. We need support. We need them to realise the value that we're giving to this community. I understand that the Liverpool City Council is struggling. I understand that. I know they don't have any money, but I believe that they're very short-sighted. They're looking at the here and now. This is what it's costing. But what they're not seeing is how, you know, one person coming through our service, that person doesn't need to go to the hospital anymore. That person's not going to go to prison anymore. Their kids are no longer in care.
Well, I actually think it should start in the schools, to be honest. I mean, you know, they're doing health and social care in schools now. But we all know, I mean, the doctors train, and I think it's half a day on what addiction is, which is insane, because it fits right across the spectrum of you know, bad health, from depression to anxiety to suicide to, you know, diabetes. It's just right across the board, liver disease. So I think if you started in school and made young people aware of what addiction is, so they're not growing up with maybe the idea that, oh, you're just being selfish, you just can't get a grip, just put the bottle down, just don't take the coke, because it's called addiction for a reason.
A press release from the Royal College of Psychiatrists from March 2021 states that funding for £26 million, which is 37% in real terms, has been cut from the youth addiction services in England between 2013 and 2020. 8 of the 9 regions in England made real-term cuts, with services in the North West being hit the hardest, losing £9.3 million.
Yeah, so the whole treatment sector, so not only controlled drugs, illegal drugs, but alcohol as well, pretty much devastated by central government cuts from 2013 to around about 2020. Those cuts have been associated, researchers have analysed this, associated with a reduced number of people entering treatment, a reduced number of people successfully completing treatment, and there's some suggestions that perhaps also alcohol and other drug-related harm increased. And we know we have high levels of alcohol-related deaths. And additional analysis as well suggested that the proportion of cuts was disproportionately higher in parts of England and the rest of the UK, but primarily England, of high levels of deprivation and high levels of alcohol-related harm. So we know there's a clear association, clear patterns between deprivation, alcohol-related deaths, the rates of alcohol dependency and hazardous and harmful use. So it really compounded some of those pre-existing differences as well. The sector really suffered over this period, great loss of expertise, and ultimately it's people with alcohol-related issues, related problems, who suffered because of these cuts.
I remember when the funding cuts happened. Obviously I'm in recovery. This is before I even was in doing what I'm doing now, so I'm aware of it because I'm very connected with people in recovery myself and addiction. And I've seen the impact it's had on people I know. And I wanted to be in a position where I could help people. I used to help people in my own home, people that I knew, maybe detox off heroin and stuff, and just try and help them get through, because sometimes people just needed that safety to go through the process. But many of my friends were in that situation, and I really wanted to be able to help, because I've lost so many friends in my own, since I've been clean, the amount of friends of mine that have died because they've relapsed and there's nowhere to get help. So the funding cuts have massively, massively affected people with addiction problems. And I know there's changes that are being made around that now, but I think I personally don't know how that's going to filter through the system. Ultimately, you need people who are willing to put themselves on the line and open the services, and I don't think the services are getting the support that they need.
The North West is lucky to have such fantastic services right at their doorstep. However, since the cuts in the cost of living crisis, some services have had to unfortunately shut their doors. One of these services was Gene in the Gutter, an addiction support service who closed in 2019 after serving the community for 12 years. In a Facebook and website post, the co-founder and director Carolyn Edwards cited the reasons as: in 2016 we lost 100% of our government funds due to funding cutbacks. Many other organisations also faced the same fate and had to close their doors. We chose to stay open, and with the strength of our community and tenacity and commitment of our team, we have continued to support hundreds more vulnerable adults since. But the need for small charities applying for grant funding has significantly increased during the last few years due to the cuts, yet the funding available has significantly decreased. We had a 1 in 3 success rates on our grant applications. With the same calibre of applications, it is now 1 in 6 and sadly no longer sustainable. I was able to speak with the Head of Finance and Commissions at Liverpool City Council and ask Susan about the last 2 years.
So first of all, my name's Sue O'Looney and I'm the Head of Finance and Commissioning at Liverpool City Council. And one of my key areas of work is drug and alcohol services. Addictions perspective, we planned for the worst and it actually was far more successful than what we had anticipated. Now, the information that I can take that from is the data that we collect in our services. So that I can't say what's happened for people who aren't in treatment, for people that may have had issues and concerns that the pandemic brought on for them. It's only for our numbers that are in treatment. And that can be quantified and qualified by looking at the NDTMS data as well. So that's the National Monitoring Data Set, and that's on the @gov website. So we're moving away or bringing together, I suppose is the better way to say it, a holistic approach as well as a clinical approach. And that's a really positive lesson to have learned. And one of the key things from a commission service perspective is services are now co-locating because it's far better to share advice and guidance and to talk about an individual. So probation and our treatment service is one of the key ones that are doing it now. They have agreed to co-locate so that they can then make sure that the individual gets the best from them, but also when they're talking and sharing ideas, it's also feeding in to the cases as well. So they're not just, as I say, doing treatment one way and criminal justice another, but from our local perspective, as I say, I think the most important thing was we hadn't taken a government cut and we hadn't instigated a government cut on our addiction services. I think it's been an awful long time. And I think for us, having inpatient detoxification programs and inpatient rehabilitation programs, so we're able to address, and we have shared care in the service as well. So we're able to do inpatient community, and we're also able to do our pharmacy. So we work across all sectors. And I think we're very, very lucky in the city to have such a really good system, and we have it mixed between the NHS and we have it mixed between the independent sector as well. And also the real must behind that is we start with the young person's drug and alcohol service. So we're very fortunate that, even if somebody comes into our services at a young age, we're able to take them all the way through. And if they still need the services in adulthood, it's still the same provision. So and those services work within our schools, work within our youth offending services, work within our early help services. So there's the family approach as well if needed.
Realising you've got a problem genuinely is the first step to getting help. There are many local addiction services you can go to, such as the ones we've spoken to today, and many nationally.
It's as easy as picking up the phone. You can pick up the phone or you can walk through that door or the garden door. And one of the reasons we have our volunteers on site is because they're our welcome hosts. Because they've had their journey themselves, someone will walk through that door. It's quite hard to walk through them doors when you're vulnerable, when you're not sure, when especially if you've been detoxing for a few days, you're not feeling great. They'll come with family members. But our volunteers are wonderful because they can tune in very easily. They can make eye contact very easily, and they'll sit and they'll offer the people a drink, and they'll tell them their story basically to take the fear out of coming through the door.